Hi, I'm Lisa Thomas. I'm a licensed marriage and sex therapist located in Denver, Colorado. I'm here today to talk to you about sex. The topic for today is erectile dysfunction. What causes sexual dysfunction? So basically about 70% of all couples are going to experience some sort of sexual dysfunction in their lifetime. So this is going to be a problem that most of us are going to deal with. So today we're focusing specifically on erectile dysfunction, situational. So we're talking about when you can't get an erection in certain situations, like when you're with your partner. So if you're struggling right now and you can't get an erection when you're even by yourself, that's a medical problem and you need to make an appointment to see your physician. So I'm not talking about erectile problems, I'm talking about situational sexual dysfunction. So that's where we're going to go. So what causes erectile dysfunction is kind of the first place to talk about. So what causes erectile dysfunction is performance anxiety. And anxiety is going to cause you to not be able to get an erection. You need two things to get an erection. You need to be aroused and you need to be relaxed. And if you're aroused and relaxed, then that should contribute to getting an erection. But if you're having situational problems where you can't get an erection, I'm here today to present a couple of tips for you to help you. So the first tip I have is to pay attention to your masturbation patterns and habits. So what I mean by that is paying attention to how often are you masturbating and how you're masturbating. So how often are you masturbating? I like to tell guys that are struggling with situational erectile problems that they should be masturbating at least every other day, and they should adopt a model of what I call the stop-start model. And the stop-start model is basically masturbating until you have a nice full erection, and then just hands off, let your erection die down, and then start again by touching yourself and re-arousing yourself. You want to do this arousing and then letting yourself die down at least 3 times per time that you masturbate. And the point of it is to sort of train your brain that you can lose an erection and then touch yourself and regain an erection. So it sort of psychologically helps you. So that's the first tip, is the masturbation. The second tip has to do with the kind of stimulation you're looking at when you're masturbating. So you might want to pay attention to the type of pornography you're watching. If you're watching pornography, trying to make it relational pornography or perhaps just use of fantasy in your head. Sometimes it's difficult when you're masturbating to a lot of pornography to duplicate that level of arousal in a partner situation. So that's a good tip to remember. So masturbation, that's the first tip. So the second tip has to do with looking at the state of your relationship. So if there's something going on in the relationship, you guys are angry at each other, you're not communicating, your body may be trying to, communicate the message for you that you can't get erection, you can't get aroused when you guys are together. So you might want to go get some couples counseling or see somebody individually to try to figure out what's going on with the state of your relationship. So that's number 2, is the state of your relationship. And then finally, number 3 is you want to adopt a model for good enough sex. And what I mean by that is 15% of all sexual encounters are going to be failures or they're going to be mediocre. So you want to make sure that you adopt that into part of your sexual practice. Nothing kills a relationship like a cycle of criticism and contempt. So if you have a bad sexual experience or a mediocre sexual experience, the couples that sort of make it through are the ones that can laugh it off, say it's no big deal, they bring each other orgasm some other way, or they don't have an orgasm that time, but they continue to touch and have a good time together. Those are the couples that make it long term, when they figure out a way to move through the sexual dysfunction instead of making each sexual experience about the sexual dysfunction or highlighting the sexual dysfunction. You set yourself up for a cycle of criticism and contempt. So for more information about me, please look me up, www.onlinecouch.com. Thanks so much, good night, and have a sexy marriage. Bye!